Opinions expressed on this show by Dr. Del Campo are solely her own. Her opinions should not be taken as medical advice. It is strongly recommended you consult with your own doctor before undergoing any cosmetic or dermatological treatments.
Welcome to Derm Talk with Dr. Roberta. I'm Dr. Roberta Del Campo, and today we're going to be discussing the importance of skincare.
Why don't we just kick it off? So talk to us about kind of your daily skincare routine, and we'll go from there.
Well, I think it's important. Most people think that a skincare regimen is all in or not all in. I mean, you have to have 20 different products or it's not worth doing at all. And I disagree. I think even adding one or two essentials really can make a difference in someone's skin over time. And the first and most important skincare regimen and routine would include something like a mineral-based sunblock. It doesn't matter the age, it doesn't matter the sex, male or female, what your skin type is, but everyone should add in a mineral-based sunblock on a daily basis. And when I say mineral, that means it includes either zinc oxide or titanium dioxide. And what this means is these are ingredients that actually reflect sunlight. So you're giving yourself the best protection. And we're really lucky because back in the day, you would think of surfers who had this like white stick and they would put it all over their face, and that was zinc. And today now we have micronized or nanized, like very small particles that are virtually invisible to the naked eye, but really do give us that intense protection. And this is something that I do recommend my patients apply every 2 hours at a minimum if they're outdoors. But if you're someone that's working inside all day long, you can put it on in the morning. And then if you're driving home in the daily sun, you can reapply it before you leave your office. But it's something that everyone can use, and over time is going to minimize the signs of photo damage or sun damage in your skin. And then I would say second most important would be something at night to stimulate collagen. The big one is a retinol or retin A. It's an ingredient that actually helps to build collagen in the skin, meaning it's thickening the skin, it's improving quality of the skin, and it's really helping to repair the skin. So it increases cell turnover. Some people can't tolerate a retinoid, even if it's a very low strength retinol. And so we have other options like human-derived growth factors. And that's something that I add in maybe 3 to 4 times a week because it's a little bit less drying, but it's something that really can improve skin quality over time. So those are my two musts, which would be a mineral-based sunblock in the morning and then a collagen stimulator at night. But those are the two bare minimums, but we can add in things like daily antioxidants in the morning. We can add in moisturizers to repair the skin barrier, and we can really expand from there. But I think having a sunblock, as we know, is the most important, and then having something to repair the skin at night.
So do men and women differ in terms of the approach as it relates to skincare?
Yeah, I would say there are two main differences. One, men typically want one product. They're like, I'm not going to apply 3 or 4 different layers. So give me the one thing I need to use in the morning and the one thing I need to use at night. So giving them a more comprehensive product. The beauty of today's products is that many of them do include multiple important ingredients. So you can have, for example, a mineral-based sunblock with an antioxidant like vitamin C in it. Or you can have a daily antioxidant like a vitamin C serum that has hyaluronic acid in it to hydrate. So you can have more of a comprehensive skin regimen within one product. And that's something I would say really differentiates men and women. I would say also men tend to be a bit more oily. So they tend to be able to tolerate products that are a little bit more quote unquote drying. So adding in a stronger retin A at night, that's something that they can tolerate better than, let's say, a woman like myself who has more dry skin.
So let's talk a little bit about trends in some of the shopping for skincare products that you see out there. I mean, of course, there are many retailers that sell everything under the sun. So what do you tell your patients that come in and they're like, hey, I went to this store, that store, I'm getting X, Y, and Z. How would you tell your patients maybe to either reconsider or take a different approach?
Well, I think, the tricky part is, of course, I would want everyone to see a board certified dermatologist. We're experts in being able to analyze someone's skin, being able to analyze what are going to be the best products to maximize their skin health or appearance. but that may not be possible for many people who live, in areas that access is a little bit more difficult, and or just having the time, the money, etc., to invest in that. So I would say that number one is someone should get to know their skin type. So, I know I'm more on the dry, sensitive side. So even if I walk into a store that has thousands of products, I might say to someone working there, can you direct me to an area or a brand that would specialize in products for more sensitive, dry skin? Also, understanding the ingredients that work for your skin type. And so that's where knowledge is power. So, really understanding that repairing a skin barrier might include ceramides or might include hyaluronic acid. Somebody like myself who's more on the dry side, maybe avoiding a retinoid multiple times a week and rather adding in something like human-derived growth factors. So, understanding your skin type, understanding what ingredients are going to best fit your skin type is number one. And then I would say when you walk into a store, obviously looking at the ingredient list on the product. So if someone who's working there points you in a direction of a particular product and you see that there are lots of fragrances or additives and it has a list of 20 or 30 different ingredients, you might want to shy away from that. So being an educated consumer is important. I will tell you though, the tricky part that we get into today is there are so many products on the market, and I've seen teenagers particularly who are coming in with acne that's inflamed and it's red and their skin is itchy, and sometimes actually taking a step back and not using so many products, and they're trying to correct it themselves. They're buying products with salicylic acid and benzoyl peroxide and retinol because they've seen all this on TikTok. But those products are actually working against each other because there can be ingredients, a lot of people don't know this, but they actually counteract each other.
Yep.
So one ingredient makes the other ingredient not work, or one ingredient, makes the other ingredient more irritating. So it's really important that if possible, when you see that your skin is reacting, it's getting more red, it's getting, more inflamed, take a step back from your products. And at that point, if access is possible, trying to see a board certified dermatologist who can point you in the right direction. But I would say I hear all the time from my patients that are mothers, them saying to me, oh my gosh, I really need to get my daughter in here, my son in here, because gosh knows what they're using. And they're buying all these products and spending thousands of dollars. And all I've seen is that their skin is getting worse. Their breakouts are getting worse. Their skin's red. They're complaining of itching. They're complaining of flaking. And that's really because they're grabbing what all of their other friends are using, but their skin type might be different.
So how often are you seeing your patients coming in? It could be a new patient, established patient, but they're coming in and they're saying, hey, doctor, I'm having either some redness or I have some irritation. I'm using product X, Y, and Z. I think that's a pretty common occurrence, right? So
it's very common.
Yeah.
And when they come to me, understanding that I am not only a medical dermatologist, but an aesthetic expert, they're coming to me also for laser treatments or for injectables. And with every new patient, I do a skincare consultation as well. So when I see them, I ask them, okay, what are you using on a daily basis? Because number one, I want to make sure that they're adding products that will actually boost their results in my clinic, that are going to maintain the results in my clinic, and that are going to balance their skin type. So just as important it is for me to recommend treatments to fix something in their skin, I also want to recommend skincare products that are going to maximize their skin health on a daily basis. And it's something that we have to think about every day. It's just like eating a healthy diet, working out, getting enough sleep, minimizing stress. All of these things play in a role together to really maximize skin health. So we have to think about what we're washing our face with, what we're applying on our skin on a daily basis, 7 days out of the week, to make sure that we are kind of maintaining that skin health. And what works for summertime might not be the same for wintertime, or what works at age 20 is likely not the same as at 25 or 30. So being able to adjust your skincare regimen during the year, so different seasons, as you're adding treatments into your protocols, as you're aging or experiencing different skin changes, this is all the time to really be able to fluctuate and be able to change your skin regimen to keep that skin health.
Oily versus dry skin. I guess elaborate on that, how certain products, certain ingredients could actually
strip the skin,
could
irritate
strip
the skin.
Could irritate the skin.
Or might be beneficial for someone who's quite oily.
Yeah.
I would say the gold standard, as we briefly discuss really is retinoids to minimize the production of sebum, so oiliness in the skin. And that's why we see individuals who tend to have more oily skin. They have blocked pores in their T-zone. And that's because dirt, debris will kind of settle in with the oiliness in the skin, dilate the pores and block them. And so we call it Drano for the pores in layman's term for retinoids, because they really help to increase cell turnover. They open and clean the pores. And so that's going to be fantastic for somebody who has oily skin. We also think about ingredients like salicylic acid being, great for somebody who has oily skin. Any type of fruit acid, whether it's glycolic, lactic, but sal acid is probably the primary one to help with that. So we're thinking of things that do actually affect the production of sebum and also keep the pores open and clean.
Mm-hmm.
When it comes to dry skin, it's really about repairing the skin, because we know dry skin has a higher risk of cracks in the skin, little fissures, which can cause more irritation to the skin and also actually make our skin look more aged, because it makes it look dehydrated, like a raisin compared to a plump grape. So the idea really is to add ingredients like hyaluronic acid, ceramides, different non-comedogenic types of oils, if you will, to rehydrate and repair the skin. One of my favorite products, which I'm sure most of my viewers will agree with, is Aquaphor. Aquaphor is fantastic for dry skin. You can use it around the eyes, the lips, all over the face if you want to. It will not block your pores, but it's really good for hydrating and repairing that skin barrier. So it's actually making the skin healthier. It's not just about plumpness, but really making sure that those skin cells are tight and they protect us from the environment.
So on that note, relative to hydration, do you, whether it's oily skin versus dry skin, the moisturizer that is applied, is there any different approach?
I would say the rule of thumb is the drier your skin, the more you should scoop out the product. So you want a cream versus something like a lotion. Somebody who's a little bit more on the oily side will want a lotion versus a cream, or even something like a serum that's really light. So texture is important. The thicker, the better for dry skin. The thinner, the better for oily skin. And I think you're also alluding to the fact that there is a misconception, because you have oily skin, you shouldn't moisturize. Moisturizing is not necessarily just about replacing moisture lost. It's actually keeping the skin barrier healthy and intact, and giving a plumpness to the skin that allows the skin to actually work as bricks, if you will, a brick wall to protect viruses and bacteria and allergens from getting in from the outside environment. And that's why we see people who have very dry skin, their skin tends to get red and irritated. And it's not just because, their skin's dry. It's because all the stuff that's floating in the air, whether it's pollution, allergens, actually have access under the skin. And that can cause redness and inflammation in the skin. Also keeping in mind, in terms of a daily regimen, it's important to not overtreat. So this comes up a lot in my clinic when someone will come in with 10 different products. And I like to pick their brain a little bit. Why are you on these products? So-and-so recommended this one and so-and-so recommended that one. And more commonly than not, I see that they're having different providers recommend different things, and then they just layer everything on. Simple is key, because it's really about making sure that we have the right ingredients that are not interacting with each other, that are allowing penetration. If you're applying a thick cream and then trying to apply a serum on top, it's not going to even get in there. It's not going to work. So, simplifying your skincare regimen, not over-treating the skin, understanding your skin type, those can be powerful ingredients to good skincare.
And sunblock is always important, right?
The most important, as we discussed at the beginning, I would say that's number one that I have to recommend is a mineral-based sunblock. And I think people think of sunblock, I don't like how it's going to feel, I don't like how it's going to look, but find that product that you like the texture. Obviously developing my own skincare line, I really wanted a sunblock that was sheer, because number one, my patients say, can you see it? Is it white? So they want something light. And I wanted something that was so thin that it was layerable. So meaning they can have other products underneath, or if a woman wants to put makeup on top, you can. So something that's very light and almost silky, so that you don't feel it. It doesn't feel heavy. It doesn't block your pores. But these are things. Find the sunblock you like and use it.
Right. So I think within the same vein, your skincare line. Why don't we go back to when you started your skincare line? Talk a little bit about how it's developed over the years. And personally, I love it. I'm a big fan of it. I think you cover everything, right? All the verticals you cover, right? The moisturizer, you cover the sunblocks, you cover pigmentation, which is really big, right?
Yes.
So talk a little bit about your skincare line and kind of what triggered you to go ahead and start that and how it's developed over the years.
Yeah, well, I think it's two things that really stood out in my mind when I felt it was time to bring in a skincare line to my patients. Number one, I wanted to make sure that I actually had control over what they're using, because knowing every product on the market and understanding every ingredient is impossible, even though I do study new hot products on the market. So, when someone's coming in and saying, well, I'm using SkinCeuticals this and I'm using Revisions that, and I may not know exactly what every last ingredient, the percentage is in there. I know when it's my product, I can tell you exactly what the percentage is of vitamin C, what the percentage is of zinc oxide or titanium dioxide in my sunblock. I can tell you what the texture is going to feel like, what it's going to, how it's going to interact with someone's skin type. So control was number one. And number two is I just wanted to make better products that really kind of fit what I like. For example, I love SkinCeuticals. I like their CE ferulic, but I did not like the smell. I did not like the color. I did not like the feel. I like the benefits of it. It made my skin look great, but there were so many things I didn't like about it. So how do we take that product and make it better, make it clear, make it a little bit more gel-like so it's a little bit thicker, it doesn't feel so thin, make it scentless so it didn't have a fragrance or a scent. So these are all things that I was able to basically take something I like and make it better. And, I did want to build something that was a comprehensive skincare line. So starting with the few most important products like an antioxidant, a moisturizer, I started there, a retinol, and then expanded to add more products that were specific to skin concerns. So, helping with dry, sensitive skin with products with hyaluronic acid and peptides, helping patients with pigmentation, which is a big passion of mine. So adding ingredients like arbutin, alpha arbutin to help with pigmentation. So taking that and expanding it to be more comprehensive for not just a daily moisturizer or a wash, but really thinking about how do I treat skin concerns with this product line.
Your line to go ahead and address pigment is really key. I think it's a differentiator.
Yeah.
So talk a little bit about the pads versus the brightening stick. Both are, I think, really all of your products are very efficacious, but I feel like those have
These are
really
two unique products.
been a standout for sure.
Yeah, and I definitely being in South Florida and Miami, I have so many patients that see me for pigmentation. Also, my personal story of melasma. It's been a big draw for me, but there were products on the market. For example, everyone, or a lot of people have heard the phrase hydroquinone, an ingredient. I was never a fan, but it's the best that we had. I like the fact that it did help with pigmentation, but I did not like that you have rebound hyperpigmentation, that it can make you sun sensitive, that can irritate sensitive skin. You can't use it when you're pregnant. All of these negatives. So how do we make a product that can do what hydroquinone does, but give it the perks of being safe on all skin types, all times of the year, the most sensitive skin, etc. And that's where understanding ingredients and hot ingredients comes in. So alpha arbutin now works very similar to hydroquinone. It blocks or reduces the production of pigmentation, but it does it in a very gentle, predictable way. And it's something that someone can use every day the rest of their life and have no side effect of rebound hyperpigmentation. So thinking about, again, how I can make other products better, it's having ingredients that do work similar, if not better, to older active ingredients, but they do it in a way that can be, safe for everyone. And going back to why I developed my clinic and why I have certain procedures, I wanted access to all skin types, all skin concerns. And this is where pigmentation has taken kind of a turn to have different ingredients and make the product even more efficacious. The stick is really nice because it's in literally a little applicator that you can paint on to individual spots. You're not having to put a messy cream. It doesn't even have to touch your fingertip. You can literally throw it in your purse. I have a patient that says, oh, I take it with me and I apply it multiple times a day. So, as long as your skin's clean, it's going to absorb it. Why not? You're going to have better results. So it's really convenient for that reason. And it's not messy. It's a great product that works. And think about even some of the really small sunspots that we want to treat, or just a patch of melasma, not the entire face. The Color Blend pads are very similar, but it's put into a pad with various fruit acids that really help to not only lighten those spots, but brighten the whole skin. That is my number one bestseller. And I will tell you, my patients, that I even have a few patients that have their own skincare lines.
Yep.
And they buy that product because it's something that they have never seen before, something that they have never seen such fantastic results, and they're hooked. So it's a product that really can be transformative and not only improve pigmentation, but prevent it from coming back. I mean, I use it every night just to minimize my risk of recurrence.
And that's for broader application.
Broader application, yeah. And more of a kind of overall brightening, not just individual spots.
Got it. what about skincare relative to your entire body?
So we have another unique ingredient, the body renewal serum. And what's phenomenal about this particular product is that we forget, many of us, about our hands, our neck, our chest until we start seeing the sun damage, meaning we don't tend to use sunblock there as regularly or even our daily skincare routine. So, what do you do once you start having that pigmentation or you start having that thinning skin? This is a product which is very rare to find body products with transformative results. This has a very gentle retinol in it, so it helps to brighten the skin. It helps with collagen production. It has brightening ingredients, antioxidants, so it's improving overall skin quality, but it's also helping to blend the discoloration that we have gotten over the years. So, I mean, if you were to look in the market, there are very few products out there for the body that do anything but moisturize. Usually moisturize, exfoliate, but what about true correction? And this product does that. I'm also very into the neck and the chest. You
Yeah.
know that it's an area that we start to age. And so there's a product called Neck Nectar,
Yeah.
which we put in the line, and that really helps to firm and tighten the skin. It has high doses of peptides. And the neck and the chest tend to be sensitive areas. So it's an area that actually improves, but it doesn't have any risk of irritation. So it's a fantastic product. And I would say one of our top 5 bestsellers.
Yeah. So when should somebody start thinking about something like a neck nectar?
I would say it's never too early to
Yeah,
start.
yeah.
Especially for those of us who live in sunny environments, have more of this daily UV exposure.
Sun exposure.
Because it's not only about sunspots, it's about thinning of the skin. We know that UV damage causes breaks in collagen, elastin. That's why photo damaged skin tends to look ruddy. We don't have that glow. It tends to start to look a little bit rough. And then not only that, but the skin does thin over time from that sun damage. So I think it's important, even when we're in our 20s, to think about using, area specific products around the eyes. Our needs are different around the eyes than they are on the cheeks. And our needs are different around the eyes than they might be for our neck or our chest or our hands or our arms. So, body specific ingredients and products really can make a difference.
Yeah. So I think in the next episode, I think we're going to cover aging, right? But I think it's pretty interesting. So this anecdotal, right? But one day I wake up and I go to you. I'm like, hey, I'm noticing a sunspot here. Never in my entire life. Now, granted, I should be better with the sunblock, and I know you pull my ear a lot, and and rat on me for not using it all.
You're
the
much
time.
better.
Yeah, I am. I'm much better, much better.
But
But yeah,
sometimes
but
it
look,
takes seeing some of the sun damage to
yeah,
get
and
better.
so it's crazy, right? I never had any issues with sunspots, and all of a sudden I wake up one day and I'm like, I definitely, bang, it's right there, it's right on the cheek.
Yeah.
And so it's one of those things that you look back and you're like, you know what? If I would have been uh, just a little bit more judicious in terms of my skincare approach, making sure I wear my sunblock, it would have been. I think I would have been a lot better off, right? But
That's where I think the younger generation is getting there. I mean, obviously, there's a plus minus to things like social media, TikTok. I hear all the time from my 20-year-olds. But many times the 20-year-olds are coming in because they have breakouts or they're starting to get sunspots or I just want to think about prevention. So we think about light microneedling. But the point is, they're becoming more educated. I think sometimes it can be over education where they think they saw something on TikTok and so, oh, that's good for my skin. I'm going to use a retinoid, and they're using a 1% because, an influencer put that on there, and then their skin is ripped to shreds. But I would say that happens, but there's also the good side of education where they are more knowledgeable about what's out there and maybe seeking a dermatologist to give them specific recommendations. But yeah, that's why it's important to start early and think about your skin, just like we think again about working out, diet, stress, maintenance, sleep on a daily basis.
yeah, and I would say the skin checks are always really important. I mean, look at me. I never would have suspected that I would have a basal cell on my shoulder, and sure enough, if I wasn't doing the typical skin checks, I think you just never want something like that to progress, right? And if you catch it early, you catch it early, right?
Yep, absolutely.
So that's always important. I will tell you, I'm a big fan of your foaming cleanser. So, and by the way, that's like the only wash that I use because, looking at just me personally, I like it foams up really fast. I wash my face fast.
It's light.
It's done. It's, and it's light. And so I really enjoy it. But you have two different types of cleansers. Kind of talk about the approach in terms of both.
And I would say the foaming cleanser is more of the universal cleanser. It's what I also use on a daily basis. I love the fact that it's light, it's gentle, it leaves no residue on the skin, and it's really effective on all skin types. The glow wash I developed for the glow because I have a lot of patients who say, I want something in the morning. I don't want to spend a male. I don't want to spend a lot of time. I just want 2 products or what. Okay, use a glow wash. It exfoliates, it brightens the skin, and then you can put your sunblock and moisturizer on top. But the glow wash is really tailored more towards someone who has dull skin, maybe a bit more oily, needs a little bit more work. But I will tell you also, my patients that tend to have beautiful glowy skin just want it because of the glycolic acid. It's great for exfoliating the skin. Somebody who's not going to use my revitalized pads, let's say it's a quick step to help to, brighten the skin and help remove some of that dead skin that's there. But, I would say both are great products. I just find that the foaming wash really is the biggest hit. And once somebody tries it, they use it over and over and over again, and even removes eye makeup, and
Yeah.
it doesn't irritate the eyes. So it's really important as well.
Yeah, you get hooked to it. It's great. What about, yeah, I know you just added a mask.
Mhm.
Talk a little bit about that.
So the mask really came as a second step to my Hydro Boost serum, and the Hydro Boost serum, another bestseller, I would say top 3. The Hydro Boost serum is really, really high percentage of hyaluronic acid. So it is different than a 1%, some of these over-the-counter hyaluronic acids that we see up to 20% concentration. So that's a really high dose. Hyaluronic acid is important for hydrating the skin, plumping the skin, helping to improve overall skin quality. But in that, I added peptides. So peptides strengthen the skin. They boost collagen. They help to boost elastin. So when you put on the serum, it not only hydrates, but it makes your skin look and feel tighter. So it gives you that boost. I also think it's important because a lot of hyaluronic acid products just make your skin look good for a minute. The minute it goes away, you wash it off, it's gone. This really gives you a long-lasting effect because of the kind of pro-peptide, pro-collagen building ingredient. On top of that, I decided to come out with a mask, which basically is that in a gel mask form. So you apply it with your fingertips, you leave it on for 20 to 30 minutes. It is intense hydration.
Mhm.
So it's really good for somebody who wants to do a weekly treatment, almost like a mini facial at their house, post-procedure. So it's
Mhm.
something that, I personally used after my Tixel treatment about a week ago daily, on a daily basis to rehydrate and make my skin not feel so tight. But it has very similar ingredients. So it has the hyaluronic acid and has the peptide. So it's going to help your skin to heal faster post-treatment. It's going to help to hydrate when the skin is dry and sensitive. It's a great product, again, for someone who wants to do a more intense treatment, once or twice a week. And it will overall improve your skin health over time.
So I was going to ask you about post-treatment. Is there any particular product of yours within your skincare line that you are typically recommending? If you think of a particular treatment that you have in the office, is there a particular SKU that you're often recommending post-treatment?
Well, now number one is the mask, and we also have a
Yeah.
scrub called the Revitalized Scrub that's new to the product line as well, that has very, very gentle, soft type of exfoliator with a very small percentage of lactic acid. So that's great post-treatment, post-Tixel, post-microneedling, post-oil therapy with the Hydro Boost. But I would say prior to that, it was the Hydro Boost serum. And it's mainly because many of these treatments, they just do. It's heat. It's going to dry out the skin a little bit. And or most people come in, they want to boost collagen. They want to, hydrate the skin. And so that's just like a number one post-treatment to repair the skin, but it doesn't block the pores. It doesn't irritate the skin. So it can be used after any treatment that I offer in office.
So thank you for sharing all that. That's great. I think you've done so well with your skincare line. I think a lot of us are, perhaps going to take a little bit of a different approach, at least to make sure that we're doing the right thing on the skincare side. I think our next episode is going to be about aging. Both of those, skincare and aging, go hand in hand. So it should be a really interesting topic. I think a little bit timely as well. So thank you.
Thanks for joining me on Derm Talk with Dr. Roberta. Please like this video and subscribe to our YouTube channel or on iTunes, Spotify, or anywhere else you get your podcasts. I'm on Instagram at Dr. Roberta Del Campo and would love your feedback on this episode. Visit my practice at www.delcampoderm.com or my web store at www.drrobertaskincare.com. See you next episode.